There are 5 common elements to a public health approach. The first is population. We start by looking at the needs of the whole population. This is different to healthcare, where the focus is on individual people, or policing, where officers respond to calls about individual victims or perpetrators. The second is prevention. We work with the belief that prevention is better than cure. We know that there are opportunities to be preventative even after violence has started, and believe that anyone can change if they really want to. We use a model of prevention that has 5 levels. Primary prevention. We work to stop violence from happening before it starts. This is often the hardest level to show that it's worked, because we can't measure what hasn't happened. Secondary prevention. This is often called early intervention, and sometimes it gets confused with primary prevention. We aim to provide support early, when violent behaviour, or some of the causes of it, starts, to stop it from becoming established. Tertiary prevention. We look to provide ways out for people already wrapped up in violent crime. Criminal justice and enforcement. Holding people to account for their actions. And attitudinal change, where we aim to shift cultural norms in society. The third common element to our public health approach is partnership. We work in partnership with our communities and other organisations in South Yorkshire. The fourth element is looking at the causes of the causes. We look behind the issue of violent crime to understand what's driving it. And the fifth element is data and evidence base. We use data to understand violent crime better and take an evidence-based approach to ensure that the interventions we use are likely to work. We then measure whether or not they did work in our area.
The World Health Organization, or WHO, considers violence a result of multiple levels of influence on behaviour, and uses this model to explore the relationship between individual and contextual factors. The first level of the model aims to understand the individual factors that a person brings to their behaviour. These factors include adverse childhood experiences, ACEs, childhood trauma, impulsivity, low educational attainment, substance misuse, and prior history of aggression. The second level of the model explores how relationships with peers, intimate partners, and family members can impact on and validate violent behaviour. Adverse childhood experiences can have huge impacts on the mental and physical health of those who experience them, with the effects often far-reaching into adulthood. Although experienced individually, adverse childhood experiences often stem from our relationships with others, and include parental separation, a parent in prison, being the victim of physical, sexual, or emotional abuse, a parent with a mental health condition, a parent with substance misuse issues, being the victim of neglect, experiencing domestic abuse, including coercive control. Victims of violence are often more likely to be further involved in violence, either as a victim or perpetrator. Schools, workplaces, and neighbourhoods all affect behaviour. Some of the community factors that influence violence include a high level of residential mobility, where people move frequently, often because of short tenancy agreements, social isolation, which sometimes comes out of a highly diverse population having little social integration, high population density, high levels of unemployment, poverty, physical deterioration of an area and little regeneration, few institutional supports, for example, when service providers have moved out of local areas and have become centralised. Many societal factors create an acceptable climate for violence. They reduce inhibitions, create and sustain division and gaps between different groups in society, or create tensions between different cultures. These include health, education, and social policies that maintain high levels of inequality between groups, the normalisation of violence as an acceptable way to resolve conflict, attitudes that regard suicide as an individual choice rather than a preventable act of violence, priority being given to parental rights rather than child welfare, entrenched male dominance over women and children, and norms that support political conflict. As a requirement of the funding from the Home Office, we have published an area profile and response strategy. The area profile, or strategic needs assessment, discusses the social determinants of life and looks at the causes of violence, as we've talked about. The social determinants of life are things like housing, employment, basic income, where we live, our environment, access to education and healthcare, our relationships, whether we're isolated, our relationship networks, community cohesion, social exclusion, poverty and deprivation. The document also presents data on adverse childhood experiences and trauma that children and young people may experience. The area profile concludes that violence with injury in South Yorkshire is related to deprivation, development at age 5, and alcohol-related harm. This means that people living in poverty, children with issues around speech, movement and toileting at the age of starting school, and those with a dependency on alcohol are more likely to experience violence. A recent survey in Wales found that individuals with 4 or more adverse childhood experiences were 4 times more likely to be a high-risk drinker, 6 times more likely to have or have caused a teenage pregnancy, 6 times more likely to smoke, 14 times more likely to be a victim of violence, 15 times more likely to be a perpetrator of violence, 16 times more likely to have used heroin, and 20 times more likely to be in prison. To break the cycle of violence, we have to acknowledge what has happened in that person's life that has led them to the place where they're committing crime. It is highly likely that there has been some adversity or trauma in that person's life that hasn't been resolved.